Healthcare is extremely important. No matter what age you are, it is crucial to find a place that meets your healthcare needs. Welcome to Celebrate Michigan, the show produced on the campus of Madonna University. I'm Chris Benson. Our next guest works in a remarkable branch of healthcare. Rehabilitation medicine isn't just about getting people back on their feet, but helping them reclaim their futures. This field brings hope and possibility to all. Today we're going to be speaking with Dr. Evan Arbit, a physician from Specialists in Rehabilitation Medicine. So welcome to the show.
Thank you so much. It's great to be here.
Excellent. So what made you want to pursue one of the most challenging professions we hear, rigorous preparation? What made you want to do this?
It goes back to the age-old thing of wanting to help people, right?
Okay.
That's why I wanted to do this from 8th grade. My dad was is a physician. Currently, he actually does physical medicine and rehab as well. And so from a young age, recognizing how a simple communication with somebody or simply touching somebody can have a dramatic impact on somebody. And I wanted to help people from whether it's a condition that they're suffering from, an ailment, or whatever it is, and helping them get over that hurdle and kind of move on with the rest of their life. And same with like an athlete who has an injury or sustains some type of ailment and getting them back to where they need to be. It's the same kind of thing and the same principles of just wanting to help people at the end of the day.
Wow. So where did you go to school? How long did it take?
Yeah.
How hard was it?
It was challenging, to say the least.
Okay.
So I did 4 years of undergrad at Michigan State, go green.
Go white.
There you go. And then I proceeded to do medical school at Michigan State as well, downtown in Detroit. They have a campus down there, so I spent 2 years there. And then my clinicals were in Farmington Hills. And then I moved to Chicago for 4 years and did residency out in Chicago at Rush University Medical Center.
Wow.
So yeah, it was definitely a journey, and I'm glad I'm on the other side of it now.
I bet.
But again, and we were talking about this before, it is really incredible to be able to have an impact on people's lives. And when somebody tells me that they're improving from something I've done to help them, like that really touches me in a way, you know, and that's all I want to do at the end of the day is do a great job, help people in the way that they need or want to be helped and heard at the same time. Because listening is so important, and being able to be an advocate for our patients, that's all we can ask for, you know?
So rehabilitation medicine, that term may sound intimidating to people.
For sure.
And there might be some like misgivings about that.
Yes.
Explain what that field actually is.
Great question. So it's actually called physiatry.
Okay.
Not a psychiatrist, that's psychiatry. I'm not a physical therapist, I'm a physiatrist, so physical medicine and rehab doctor. It's actually interesting, physical medicine was kind of created in the early 1900s, and it was using modalities, so heat, cold, different types of things to help patients. Rehabilitation kind of came into the frame with physical therapy, occupational speech therapy. After World War II, the kind of blending of the two spheres came together when injured soldiers came back from the war and they needed rehabilitation, so spinal cord injury, brain injury, things like that. So at the end of the day, what I focus on is helping people after ailments, conditions, spinal cord injury, brain injury, neuromuscular conditions, any type of musculoskeletal conditions. And I work alongside a team of physical therapists, occupational therapists, speech therapists, to kind of help patients improve their function at the end of the day. And so you can be in an inpatient setting working in hospitals, so seeing people, do they meet criteria to come to an acute rehab after they've had a condition such as like a stroke or a spinal cord injury, or you know, a back injury that required surgery. But then you can also be in the outpatient setting too, seeing patients for chronic pain management, for like I said, neuromuscular conditions, any type of muscular condition, musculoskeletal condition. So the breadth of the practice of physical medicine and rehab is so wide. We can really do so much. And I think what's great about our specialty is we can be creative. People oftentimes are like, we're stuck, we don't know what to do. And that's where we come in, because we can do what people don't necessarily know that are options that are out there, you know? So that's why I love this specialty. I'm really passionate about it, because we're like the last stop, you know? We can help people get to where they want to get to. So, and I love that it's a team-based approach too. You know, we work very closely with our therapists. to kind of help people along the journey of their condition or their ailment.
So you mentioned like physical therapy, occupational therapy. People might be familiar with physical therapy.
Sure.
You know, okay, I'm going to go do some stretches or exercises.
Yes.
What about these other ones that you mentioned?
Yeah,
Can you give us a little definition of those?
Sure. So physical therapy helps on mobility, balance, ambulation, so walking, things like that, bigger muscle groups. Occupational therapy helps with ADLs, so activities of daily living, things that are maybe simpler before that maybe are more of a challenge now after somebody has a condition or injury. So dressing, bathing, toileting, hygiene, who does the cooking, the cleaning, helping patients to toilet again, hygiene again, things like that. And then speech therapy is actually a wide breadth of things as well. It's not just getting your speech out, they work on swallowing, because think about a stroke, and oftentimes people have impaired swallowing after stroke. They also have impaired cognition, thinking, memory. So all of that kind of plays into the rehabilitation of a person and a patient. And so we use all of those different therapies to kind of help guide us.
And the idea of pain. So our perceptions of pain, I'm sure people come to you, maybe like you said, maybe they're the last stop. You know, they may say, I've just had so much pain and I'm looking for relief.
Yep.
What do you think is one of the big misconceptions about pain that you encounter?
Misconception about pain, I think, is that pain is untreatable, right? And I think we need to have realistic expectations with patients, right? So we may never be able to fully treat their pain altogether, right? Living with some form of chronic pain is probably going to be part of their clinical picture, depending on what they come in for, et cetera. But getting them to a more manageable level to be able to live, to function, to do what they need to do, that's where we come in, right? So I think to say like, oh, we're never going to get you better,
right?
We can always try.
Sure.
And that's where we want to be part of the patient's story, you know?
Wonderful. Well, oh my gosh, we have to take a break already.
Okay.
So hopefully you don't have somewhere to go.
Not yet.
Okay, good. We will be right back after this short break, and we'll get to explore more of the world of rehabilitation medicine. Stay tuned.
I'll never forget the day our landlord called and said, read your lease. No pets allowed. My owner tells him my dog ate the lease, but that didn't work. And now I'm stuck in a shelter. But this pit bull is ready for a new crib. I'm loving, loyal, and play well with others. So don't be intimidated by all my muscles, because the biggest one I have is my heart. That's right, I said it.
Maria, so how's work?
It was fourth period biology. Our students just weren't getting how easily viruses spread. So Miss Bell and I had them role play a zombie virus outbreak. By the time they had all learned the lesson, all the living were dead. Hey, how's your job going?
That big sales meeting I planned? Next year. I might get to go.
Cool. Come on. How you feel? How you feel?
I'm feeling good. Spin me, spin me.
Gotcha. Oh, goodness.
Welcome back to Celebrate Michigan. I'm Chris Benson. We're continuing our conversation with Dr. Evan Arbit from Specialists in Rehabilitation Medicine. So tell me where the specialists are located and how people can kind of find them.
Yeah, so we're in Commerce, Bloomfield Hills, Rochester. We also have a practice in Port Huron as well that we're kind of ramping up. But we are in all of those locations. Those are our outpatient offices. We also have PT right attached to those locations as well. And then we are at a couple of different hospitals across the Metro Detroit area too. And then I think your question was like, how did I get involved with specialists? Yeah, so my dad actually works at the practice.
Oh.
So it seems like the next step after moving back from Chicago to kind of join him and work alongside him. And it's actually been incredible. We see each other about a day and a half a week, and we work very well together. He's been doing this 30 years, and I'm just getting into this. I just started in July. But there's different things that he doesn't necessarily know, and there's different things that I don't necessarily know. So we kind of work together and play off of that, and it's been a really great experience so far. So.
And I saw you have a number of physicians there and different people that you work with. And so I bet that experience of working with your dad has been great.
It has been, yeah. I'm really lucky. And everyone else at the practice has been really welcoming and warm too. So.
Awesome. So you've got different locations.
Yes.
Same kind of services at each one? Does any of them specialize?
Some of them are specialized in pain interventional procedures. So doing epidurals and things like that when people have, pinched nerves in the back. Radiating down the legs or in the spine or in the neck, causing symptoms down the arms. So they can do those interventional procedures. There's certain nerve blocks that that two of our physicians do currently that I don't necessarily do because that's extra training. And it was something I just didn't find interesting for me.
Understood.
So I'm as general rehab as you can get. I love, our spinal cord injuries, our amputees, everything under the sun, musculoskeletal conditions. But yeah, and I'm primarily in Commerce and Bloomfield offices, and I do a couple of days inpatient rehab as well. So, yeah.
Well, I understand you brought, to help our audience really see what this looks like and give them a perspective, we're going to watch some video, and I'm going to ask you to talk through it and explain to our audience what we're seeing.
Sure. So this is our Bloomfield location.
Oh, awesome. Motion. I love the motion of the logo.
So here is an EMG or a nerve conduction study test that we do on patients to assess how the nerves are working, how strong the signals are being sent. It looks at the peripheral nerves. This is an ultrasound guided injection that we do. This is one of our therapists, Margie, working on shoulder stabilization, strengthening. This is lumbar spine, core. This is a bird dog that she's doing. Looks like a warrior position from yoga that she's also helping this patient go through. So again, I really like working hand in hand with our therapists as well because we help give the diagnosis and then we're able to kind of monitor their progress because they're right next door to us in every single one of our locations. So we constantly are communicating about our patients even between appointments to make sure people are improving and getting better.
So much, I noticed different.
And this is, sorry.
Look at that. No, go ahead.
That was just an examination looking at somebody's vibratory sensory symptoms, and that's one of our other physicians, Dr. Roth, and this is somebody looking at imaging. Looks like of the ankle.
I love that you can see that and know what that is.
Yeah.
The rest of us are like,
what's that?
Yeah, what is that?
And this is actually one of the techniques some of our therapists do. It's called Graston. You have to take special courses on it, but it's a really great modality that kind of helps with people who have muscular dysfunction, myofascial pain.
Wow.
And this is some of the massage that our therapist, this is Courtney, in our Bloomfield location does. So.
This just makes me want to go.
Me too. Honestly, I feel like I need this.
My neck is a little sore there.
And that's ultrasound that we're using too. So we have a lot of different modalities and things that we can use to help patients improve.
There's just a lot of technology I noticed. How has that changed in the field, and how does that help?
Honestly, so we're looking into doing a lot of regenerative medicine nowadays, and what that means is instead of using as much, steroids and things like that, which steroids are great, right? They're the best anti-inflammatories that we have at the end of the day, but they're also a means to an end, right? We don't love injecting steroid all day long, even though people love it. So and this is Dr. Atchman. He is one of our interventional procedures. So he was just doing like an epidural on one of our patients. So
wow. So that really showed just a broad,
like the breadth of what we do, you know. And we do even more. But what was the question that you had asked me?
About technology, because I noticed there's so many different things I saw. You know, I saw some weights, and maybe if I'm watching and I'm like, okay, I get that, but then some of those other machines might look intimidating, to people. But I noticed you had someone right there kind of guiding you through it.
Yes, there's always somebody there. And I always tell my patients, like, okay, you're in all this pain right now, right? One, we're going to work on that. Two, the therapist will meet you where you're at, right? They aren't going to just throw you into anything like this. And and sometimes people need a graded program to kind of help them as they move on through their rehabilitation journey. But again, what we were talking about is the regenerative medicine and kind of the future of how things are looking. So we're kind of trying to be at the forefront of this. And what I mean by that is using PRP, which is platelet-rich plasma, which is essentially taking your own blood and kind of using it to re-inject it into areas where people are having, knee pain from knee arthritis or shoulder pain, whatever it is. But it's essentially using your own tissue to kind of help cause a local inflammatory reaction that's a good inflammatory reaction. And we want to do those things rather than using steroids. We're looking at using sound wave to kind of help patients who have muscular dysfunction and muscular pain. So we're trying to start offering that hopefully in the end of December. So, we've got a lot of things that we're looking into, and I think that's exciting, and the future is bright.
Yeah.
So.
Well, and I'm sure people who are listening who are thinking, I've tried so many different things and they're not working.
Yep.
This is a great way to give them some hope.
Absolutely.
Well, we have another quick break. When we return, we'll discuss more about rehabilitation medicine. Don't go away. We'll see you soon.
Not yet.
Nice. No. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Welcome back. This is Chris Benson, and we're on Celebrate Michigan, and we're very excited again to have Dr. Evan Arbit with specialists in rehabilitation medicine. And you were talking to me during the break about lifestyle medicine. So what is this?
It's a great question again. So lifestyle medicine is a newer specialty, just kind of like physical medicine. It's really gained so much momentum in the past 10 years, thanks to the American College of Lifestyle Medicine. But it is a separate specialty that looks at how lifestyle factors can contribute, worsen, or be the root cause for some of the most common medical issues that people are experiencing. So cardiovascular disease, high blood pressure, diabetes, cancers, certain cancers, for instance. So essentially it looks at 6 different pillars. So physical activity, nutrition, sleep, it looks at stress, it looks at social connections, and then also looks at avoidance of risky substances.
Wow.
Yeah, so we kind of look at people as a whole, right? Holistically, which is, I'm a DO, so I'm a doctor of osteopathy, and that's how I want to look at patients, right? It's not just that you have knee pain, for instance, but why is that? What else is going on in your day-to-day life that could be contributing to it?
Yeah.
And we know that nowadays about 60% of osteoarthritis is actually related to metabolic arthritis.
Wow.
So the metabolic factors that are contributing to patients not only worsens the arthritis, but can speed up the process of arthritis. So if we look at identifying, you know, what are patients eating? How are they sleeping, if they are, for instance?
Yes.
How are they moving? Because I'm sure they're not moving as well as they could be. Their social connections, because post-COVID, we're living in a very isolated world. And then looking at how those substances that people are taking affects everything else in their day-to-day lives. And so how all of those things can contribute to the complete picture of the patient. So I got interested in lifestyle medicine 4 years ago and went through the whole board certification and whatnot. And what I like about it is that it's all evidence-based, meaning that everything that we try to do is all data-driven. So it's all backed by research and things like that. And it's not that I'm asking people to rewrite their whole story and their whole idea of how they live their lives, but it's making small changes, small behavioral changes that hopefully will lead to bigger changes down the line. And again, patients have to be ready and willing and able to make and want to make those changes. And so that's sometimes where the coaching aspects of this comes through. So I try to incorporate a lot of this into my physical medicine and rehab appointments when I see patients too, because a lot of this so much overlaps, right? If we're in pain, how are we sleeping, right?
Right.
And so if we're not even addressing that, you know, that's a huge flaw, you know, and we live in this also culture of sick care, right? We should be looking at more preventative care and dealing with the root causes of why patients are having the symptoms and the ailments that they are. So
it's such a foundational shift, and I think in my lifetime, you know, I think about my experiences going to the doctor, you know, when you're sick.
Right.
And they're very quick appointments. You know, they're not asking me like, how are you, in the past, you know, how are you sleeping? What are you eating? You know, and what's your stress level like? And I love that you're describing this more holistic approach to it. And what has the reaction of your patients been who have gone through these this lifestyle?
So I'm just getting it started, but so far people are responding very well to it. And again, it's not overnight, right? We have to invest and want to be able to make these behavioral changes. So I see patients more regularly, like usually every 2 weeks, because I will give them what's called a SMART goal, something that's smart, measurable, attainable, reliable, and in a time period. So giving them, and I will usually write it out as a prescription because I like handing people something that is tangible, right? And then they have to be able to go and do those things. Well, they don't have to, but you know, I'd like them to. And hopefully they will want to be able to do those things too. So I think having that follow through with patients is really helpful, right? And then seeing them sooner rather than later to say, hey, how did that go? You know, we wanted you to increase the amount of fruits and vegetables you're eating, right? And or fiber or whatever it is, because this will help you from an inflammatory standpoint or whatever it is. But I think they're responding well to it at the end of the day. And I think that's where the future of medicine lies too, is working not as a sick care society, but well care and also preventative care too at the end of the day. So.
Well, I know we've probably got folks watching and they're like, tell me the name of this again. Where can I find you? So what's your website? Where can people find you?
Sure. So it's Specialist in Rehab Medicine is the name of the practice. And then it's www.sirm pc.com.
Okay.
And so everything's there, all of our phone numbers, all of our office locations. And like I said, I'm in Commerce and Bloomfield. I occasionally am in Rochester and definitely in Port Huron too. So I'm all over the map.
And when you think about, again, if there's people suffering and they just are like, this probably won't help me, I'm very discouraged, or maybe they have a condition and they've just kind of settled for a lower quality of life, let's say, you know, they just have kind of been resigned. What would you say to anybody who's watching who might be in that position?
I'd say, one, give us a call, because if you haven't seen a physical medicine and rehab doctor, that would be one of the first things in my wheelhouse to do, because like I said, I think we just have a different perspective than some other providers, and I'm not bashing other providers,
no,
but
of course.
I think it's just that we look at things differently. I think that's how I've been trained, is to look through a different lens, if that makes sense. So, and I always tell people too, at the end of the day, like there's hope, right? And I'm a very optimistic person, so that's all I want to do is help people. So.
Well, we are so glad that you spent some time with us
Thank
today
you
to
for
help
having
people
me.
understand a bit more about this. So thank you.
Thank you.
And thank you for joining us and learning all about the wonderful things that happen here in the Mitten State. Until next time, see you soon.